Everybody knows each other, right? I don't know if we need to do introductions today. Anybody want to do introductions? Okay, let's keep moving forward. Katie, will you remind us which strategy we're on?
Yeah, so we're going to start with strategy. Wow, two. So just to recap, we've already ranked our strategies. Right now we're focused on tactics. So last meeting we did, I believe, tactic 5, 4, and 3. So we're left with 2, 6, and 1 today. And then once we just rank and prioritize these tactics, we're done with the setup for this sector. So I'll give everybody just a second to log in. Yeah, and if you want to go ahead, this little thumb over here, if you want to press that when you've accessed the Mentimeter, that'd be helpful. Okay, I'm gonna go ahead and get us started. So just as a reminder, tactics represent the specific actions used in applying a strategic choice. That says the same thing, my bad. So we are starting on tactic 2. So if everyone wants to go ahead and rank on their own, what we'll do afterward is we'll discuss them and kind of figure out what we want to change as it applies to the KC region. And if we want to keep all tactics, we can, or if we want to eliminate some because they're not applicable. Yeah, Joey?
Katie, do you have the language for strategy 2 somewhere?
Yes.
I just want to review that real quick, just so we know.
Actually,
Here's the big strategy, and then here are the tactics under it, so that we can be like, yes, this works with this in Kansas City, or no, it doesn't.
so I'm actually also going to post the link for anybody that wants to access it on their own.
Yes.
And then, give me just a second. I thought I actually had this already pulled up and I didn't. So
strategy 2 is public health agencies should create, maintain, and leverage cross-sectoral partnerships and coalitions that implement evidence-based strategies to promote physical activity. Cool. That's pretty easy. So the tactics then, yeah, you want to go back to that page. I guess I'll read through them because we're all going to read them anyways. Examine successful cross-sectoral partnerships to identify and incorporate key elements of success into physical activity initiatives. Okay. So, I mean, examine successful cross-sectoral partnerships. So what is already working, right? That's a good thing, I think. And the second tactic, encourage and train public health professionals to work with, educate, and learn from partners in order to strengthen. Katie, will you go? There you go. Strengthen the effectiveness of partnerships and the efforts of each member. Tactic 3, increase networking and collaboration between practitioners, researchers, and community-based organizations and advocates. Tactic 4, collaborate with agencies representing persons with disabilities and other populations affected by health disparities. And then the last one, collaborate with non-traditional partners to increase the reach of intervention and encourage social capital, encourage partnerships between local and state agencies and scientists in academia and private settings to conduct community participatory research to facilitate the dissemination of evidence-based practices to promote physical activity. That's a mouthful, y'all. So I guess the first question, go ahead and rank those as those kind of rankings are coming in. Are there any here that we should talk about that do not belong in Kansas City, that do not make sense here? Sandy, you look like you have something to say. No? Okay. DC, Simone, anybody else?
Yeah, I feel like we can use all of these here. And I think they're all things that can be done here.
Cool. Robin, Natalie, Katie, you guys have anything?
Yeah, I just think they all seem really good and all seem, I don't want to say like low hanging fruit, but they're like, it doesn't require like new funding, a lot of resources to do them. So that I rank them all pretty high.
Yeah, same. The last one is long, and whoever wrote that at the national level needs to like, it's like a paragraph from one of my students that has too many different topics in the same. You know? But it's good, I think. I mean, I agree with everything in it. Okay. Oh, sorry, I didn't submit my things. Sorry. Cool. Any other feedback, comments on that? Anybody want to discuss anything? All right, let's move on to number 6. So strategy 6, guys, as a refresher, public health agencies should invest equitably in physical activity commensurate with its impact on disease prevention and health promotion. So we're talking about funding, I think, here. So yeah, let's go ahead and rank these guys. So provide resources in state and local health agencies and programs for physical activity comparable to resources provided for tobacco and nutrition. Provide sustainable funding for state and local health departments so that physical activity and public health specialists can create and implement initiatives that promote physical activity. Can I make a recommendation that we scratch out state and there and just make it local health agencies? Local, and there's another one, local health departments. Anybody have any problems with that? Any other comments on that first one? Okay. The second one, fund public health professional societies, schools, and public health and other academic units engaged in physical activity research to develop tools and resources for policymakers and practitioners that support the promotion of physical activity in communities. Any comments on that one? I don't know if that's, I guess this is what's throwing me off is like, is that our place? Go ahead, Robin.
Well, I guess first clarifying question, how many like schools of public health are there in our region?
So there's no school of public health, well, except I guess.
KU Medical Center.
Yeah, KU Med has the MPH program, right? But they don't have a school of public health. Mizzou will have a school of public health in the near future. I don't know if there's a region or not. Like, it's not like, yeah.
Are we talking about College of Public Health or a focus or?
School of public health, yeah, in the academic literature or in what the academic folks speak is a very specific thing. But if we're just talking about like MPH programs, there's KU, K-State, Mizzou.
UMKC has like a program, a bachelor in public health. Or
We have a bachelor's, but it's going away.
Okay.
Yeah, we have a health science minor, but or major.
I mean, I would think we wouldn't be funding those particular groups or types of groups. I would think it would make more sense if we were talking about funding to really look at, I mean, we said provide resources in number 1, but even if we were talking about funding, I would think we want to do that at the local level where we can have more kind of Kansas City local impact. But that's kind of my thought.
I agree with you there. That way we can have more control over where those resources go.
Is anyone opposed to scratching it? I don't know if it I don't know if it makes sense here.
Well, yeah, this as I'm kind of looking at all these tactics here, like this group has very, very little control over any of these things. So is this just something that is almost kind of like, and I can't remember where strategy 6 was ranked on terms of, which ones are like top of the list and which ones are bottom, but it could be that this is just kind of like a, declaration of what we believe, as opposed to like, here are things that we're actually going to try to accomplish. Does that make sense? That's just one way of thinking about it.
Yeah, Robin, I think if I remember right, guys, going back to when we ranked the strategies, this is like 5th on the list out of 6, right? So it's near the bottom. But we ranked it in the square of like really important, but like impossible to change, right? And so it's really hard to do, but it's really important. I don't have a problem funding, I mean, obviously we need schools of we need people to teach folks about public health, right? But I don't know. That's a good question, Robin. What does everybody else think, to Robin's point of like, do we just keep these in as declarations of like, this should happen and not focus on it? DC?
I agree with that, because I feel like all we have the power to do, I mean, because we don't have the power to increase funding for CDC or anything like that. Like, all we can do is advocate, right? So I agree. We should just, if anything, we should just be advocates for these things. We find all of this important. We should fund, public health, professional societies, all those things, but we don't have the power to do any of those things.
Other thoughts? Sandy's nodding.
This is very much in the weeds, but like when we started the physical activity plan 4 years ago, we brought in this speaker who's he's the chair of the National Physical Activity Plan. And we were just having a conversation. He said, you know what? There is something meaningful in just standing on a soapbox and saying that we feel that physical activity is a public health priority. And like, he's like, you may not be able to like specifically do a lot about it, but just having people say, hey, this is important is a meaningful action to take. So this kind of these set of tactics are kind of like that, I think.
Like stretch goals, right? Like it's going to take a long time to change like funding for public health, but that's where we should be going. Yeah. Okay. I love it. So let's keep them in. Do we need to change number 2 for anything? I don't think so.
Well, I mean, the only thing I would say is if people wanted to call out the specific local programs, like we think the, KU Med School of Health Professions or whatever, population studies or whatever should, increase their funding or something.
I mean, that's the one school, the one MPH in the metro. And I do worry though, if like, there are, Rockhurst might get an MPH in a few years, right? And so do we like, I don't know. I'm always worried about that kind of stuff.
Yeah.
Yeah. Other thoughts?
Or you could just say local programs or something.
I like that. What do you guys think about like local public health academic units?
I like that only because it kind of, it's broad and it also includes maybe non-official groups. I know there are smaller community groups that also teach public health that to like kids or teenagers, high schoolers. So that could also include that level of education.
Yeah, that's cool, DC. I didn't think of it in that frame, but yeah, that's a good idea. So, Teresa?
Hi, everybody. I'm a nurse and a health educator at Clay County Public Health Center. And I've worked here 18 years. I've done public health with Jackson County Health Department, Platte County. And we have the Missouri Department of Health maternal child health contract, which most of the Missouri health departments do. You have a choice of different focus areas, and we are working on the physical activity and healthy nutrition. And I can just tell you that we work primarily with daycares, and it's never been really easy. I think daycares have so many challenges, but since COVID, it has been extremely difficult to get any of the daycares to agree to participate with us. And we try to explain to them that we want to come in alongside of them when they have parent events or different events for their teaching staff to bring that kind of information. And so it is definitely an uphill climb. So, I mean, as far as actual boots on the ground and actually trying to do this in communities. So we have this will be our 8th annual Family Fun Day event that we put a lot of our money from that grant into. Last year, we did it at Mackin Park, since we could be in person again in North Kansas City. That's I would say, one of the premier parks in the Northland. We're going to hold it there again this year. Last year, we had close to 40 vendors and over 800 people. And this year, finally, we actually had vendors pursuing us wanting to be in this. So we have high school jazz bands involved. I mean, we make a lot of ruckus during the time that we're in that park and draw a lot of people that are there, for other things. So I don't know. It's very, very challenging to think of innovative things to get the word out, how important it is for families to be active with their kiddos. So that's why I tap into these. I want some new innovative ideas.
Cool. Yeah. I mean, I think where we're going. Let's get these ranked, because we're almost halfway through our time. So I want to make sure that we get it done. So if you haven't, read through and select your responses yet, I'll just read the last 3 real quick. Provide sustained funding and resources to local, state, national public health agencies that support physical activity practitioners to act as conveners of multi-sectoral coalitions. Is that right? Yeah. And provide leadership for strategic partnerships. That's number 3. And then number 4 is encourage CDC and USD HHS to invest in capacity building to support MPH and PhD programs in public health stuff, especially at the PRCs. And then the last one is increase funding for CDC, PRCs, Physical Activity Policy Research Network, PAPRN, and the NIH. Are there any discussion on this that we should have before we move forward? Going once, going twice. Natalie?
On that last one, should we say like advocate for at the beginning? Because it's not like we'll be able to increase funding for those necessarily.
What does everybody think?
I agree with Natalie.
I think I do too.
Yeah, I think DC kind of mentioned that in his comments
Sounds
earlier.
Okay. Yeah, I mean, that sounds great. Do we just want to do the last one, like advocate, or do we want to encourage or advocate for CDC and USD HHS capacity building? I guess encourage is fine there. Maybe.
I think advocate or encourage would work.
Any other notes? Katie, you got that change?
Yeah, I've got the notes. Number 3. Provide sustained funding and resources to local, state, and national public health agencies. So focus just on local rather than state and national.
I mean, I don't know, like the rest of them are national stuff, you know, if we, I mean, we could add advocate there, advocate for sustained funding at all of these levels.
I think I agree with that. I just so the last 3 strategies, when we were ranking these tactics, we had that same issue that a lot of them are focusing on a national level, and we decided to not include those.
I know.
So I guess that's my only thought. Yeah.
Yeah. Oh, Teresa has a comment. I think that the action happens at the local level, so. What does everybody think? Should we scratch state, national public health agencies from number 3, or do we keep it in and maybe change provide to advocate for? I will say that I think my preference would be to advocate for sustained funding at these different levels, because there's other levels in the other ones, and so, you know, why pull out? I mean, in this strategy, now I know we've stripped national stuff out of the other strategies, but in this one, it really is like funding across the board, right? Everybody's good with that? Thumbs up? Yeah. Cool. Okay. All right. Katie, what's the last one? Strategy 1. So strategy 1, guys, just as a refresher, public health organizations should develop and maintain a workforce with competence and expertise in physical activity and health, and that has ethnic, cultural, and gender diversity. So let's go ahead and rank these. Promote efforts by the CDC, professional societies, and academic institutions to provide training, capacity building in the use, adaptation, and evaluation of evidence-based physical activity promotion strategies.
Hey,
Can we
Joey,
say-
really quick.
Yeah.
Before you continue, okay, I just want to get a quick word in. There are 14 tactics actually to strategy 1. So as a reminder, because limitations with Mentimeter, we can only do 7 at a time. So there are 7 more after these 7. Heads up.
That's fun. It's a lot. Yeah. So tactic number 1, right, is promote actions by CDC, professional societies, academic institutions. Should we change to make this more local? Should we, you know, promote efforts by local health agencies, academic institutions? To provide training, capacity building, and use adaptation, blah, 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 blah.
Yeah, we might as well just change. I mean, and someone else chime in if you don't agree, but I think we should change everything that includes, we don't have to cut out state or national, but like just include local and everything. Any effort that is mentioned, just include local automatically.
Yeah. I think promoting or, you know, raising awareness for physical activity on a national level is a good thing. But also, I agree, adding the local level would be good.
Who's agrees including local on most interventions? Okay, so if we could include local there, Katie, and number 1. Number 2, build the capacity of practitioners to monitor the key outcome measures of chosen physical activity interventions. I don't have a problem with that one. Anybody else? See you, Robin. Number 3, enhance academic programs with physical activity practitioner core competencies embedded into the curricula of public health and other disciplines. I think that's fine. Increase the number of masters in public health programs that provide training on physical activity and its promotion. Increase the number of graduates from these programs. I think that's great. What is that? Number 1, 2, 3, 4, 5. Expand recruitment, outreach, and training efforts to engage students of diverse racial, ethnic, and cultural backgrounds, students with disabilities, and students representing groups at a particular risk of physical inactivity. That's cool. Encourage professional societies to sponsor scholarship programs, yeah, for students of diverse racial, ethnic, and cultural backgrounds, students with disabilities, da, 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 da. I think that's great, right? Collaborate with a wide range of organizations, including those who are representing minority ethnic groups and persons with disability, to build a diverse public health workforce that is well prepared to promote physical activity. I think that sounds good too. All right, has everyone voted? Yeah, cool. All right, Katie, shall we move on to the next one? It's the second group. Is there, wait, before we move on, is there, sorry, Katie, is there anything that anybody wants to discuss on these 7?
I will say as a reminder, when we were ranking strategies, this was the bottom.
Yeah.
So it's, yeah, just a reminder, and it's interesting to see like how we have ranked at least the tactics. And I know when we went back and discussed this further, we've realized that this is something that is achievable and we can focus on. So just trying to provide a quick refresher.
Natalie, were you going to say something?
I kind of decided not to, but I just kind of wondered like what the need was or like for those MPH programs. I don't know how many, is there really only KU Med here?
And they
Or-
don't teach, I mean, they really don't teach about physical activity.
Okay,
Yeah, so the only physical activity as a core competency in MPH programs, there's like 3 or 4 of them around the country. One's at K-State, which is where I went to school. And then like South Carolina, Duke, I think has an MPH in physical activity. And I think that's it, right? So, oh, maybe UCSD, University of California, San Diego. Russ, what's his name? Tiny guy. What's his name? Active Living Research. You guys know who I'm talking about. Salas, Jim Salas. Yeah, he you know, has started all that stuff down there. Okay. Any other comments? I don't know. I guess I didn't really answer any of your question, Natalie. I mean,
no,
I think
it's fine. I guess I was kind of wondering how we're gonna influence that in our group. But I guess our curriculum group's doing it, so it's possible.
I mean, I don't think we can necessarily do anything about that, but I think it's like the funding one, right? Like we should say that it's important, but you know.
Yeah. Okay.
Yeah. Next one. Oh, hey there. Welcome.
Hi,
How are you?
I'm good. I'm so sorry to interrupt.
No, don't worry. We are just moving forward here. So Katie, number 8, I'm gonna move on to the next one. So the second section, or the second 7 of these, the next one's support and expand training opportunities based on core competencies for practitioners, paraprofessionals, community health workers, and professionals in other sectors. Develop interdisciplinary training to ensure that physical activity and public health concepts are connected to other disciplines, including leadership development and team building. Increase the number of professionals who are certified physical activity public health specialists. Support the creation of physical activity and health unit in state health departments that functions as part of an integrated and coordinated approach to chronic disease prevention. There's so many of these. And stop me, anybody, if you want to talk about any of these. Staff these units with certified public health or physical activity and public health specialists, and with professionals from other disciplines with whom public health must collaborate in order to provide opportunities for physical activity within communities. Some of these are like so wordy, it doesn't make sense. Encourage national and state public health associations to form physical activity sections within their organizations. I think that's a really good one. Encourage professional societies in public health to adopt and disseminate core competencies of public health practitioners in physical activity. Update the core competencies regularly. Physical activity or public health agencies should create, maintain, and leverage cross-sectoral partnership. Oh, that's the next one. Sorry. Okay. Let's rank these guys. And as these rankings are coming in, if anybody has any comments or suggestions, thoughts that we want to share. Is that everybody, Katie?
Are there,
Go ahead.
5, I think we're waiting on one more. Are there any of these tactics we combined together like we did previously? I want to say with strategy 5, we combined a couple of those tactics. Because a lot of this obviously is focused on like training future public health professionals to be knowledgeable in physical activity. And it's focused a lot on in academic institutions. Do you think that there's any two we can just go ahead and combine that makes sense together?
Yeah, I kind of semi disagree with the academic institutions piece. I think some of them are focused on that, but there's all this stuff in the other strategies too that academic stuff has to do. But I think a lot of these are focused on like current physical activity or current public health employees, right? Like increase, like starting a public physical activity unit in a health department and then staffing it with employees. The way that works in the real world is that you move people around, right? You rarely are going to hire new people to do that kind of thing, right? I mean, ideally you hire somebody with the expertise already, but more than likely you train somebody up who's already at the health department.
Okay.
Anybody else thoughts?
I have thoughts about number 12 about staffing with certified physical activity and public health specialists, just because I wonder if that kind of limits puts a limit on staff, because there could be community members that could staff those who also know more about their areas and how those factors play a part in physical activity in those areas. And it doesn't mean we can't get them certified, but just kind of being aware of, you know, that piece of it.
BC, I think that's a great point. Anybody else? I guess DC, how would you want to change it? I think a change is worthy, but how would you, do you have a recommendation? Maybe staff these units with individuals with expertise in physical activity, e.g. like e.g. public health physical activity specialist, community members,
Yeah, that would be great. I think that'd be better.
Katie, did you get that? Cool. I think that's a good addition, DC. Anybody else? Yeah, okay. Katie, what else?
That's it. So now that we have finished, you know, kind of figuring out what strategies we want to focus on and these tactics, next steps is I will be putting together essentially a document about the overall overview of our sector, and then the strategies in order with their tactics based off of the rankings, and probably a developmental page. And that'll go out for review, and then we'll put that into the key CPA plan. And then our next steps is that, I know I've mentioned it a couple of times, and I think Joey might have, like in our first few meetings, is we have funding available through the key CPA plan for each of our sector groups. So we have $12,000, our healthcare sector has $12,000. And what this is for is to apply to create projects or fund opportunities that support our sector's strategies and tactics. So we can start doing that once we finalize our public health sector, like KCPA plan portion. That's really the next steps.
So Katie, correct me if I'm wrong, but we're gonna take August off, right?
Yeah.
Well, Katie needs some time, guys, to get all that done, and like she'll send it to us for review, and if we have changes or whatever, we'll incorporate all those. And then she needs time to do that. So we'll meet again in September.
Yes, and then I think I had it down here. I might have gotten the date wrong. No, I didn't. My bad. Give me a second. So it should be, today's Thursday, second Tuesday or Thursday in September. So September 14th would be our next meeting day.
Does that work for everybody? I want to keep this kind of core group of people on at the table. And so I'm gonna, like, does that work for everybody here? 14th at noon, Katie?
Correct.
Yeah, that's fine for me. Cool. Okay. So Katie, will you go ahead and put that? Do you say, I don't know if I always forget. Do you put in calendar reminders?
No, so I created an Eventbrite, which I have not done yet.
Okay.
But I will get that out right after this meeting, and I will send out the overall email tomorrow. And so
Cool.
just sign up as soon as possible.
Yeah, so either put a hold on your calendar for that, guys, or sign up. So I think in September becomes the fun part, right? Where we kind of have done all this work to figure out, you know, all these things. And now in September, we can come to the table with fun ideas of what we think we want to do in order to impact this area. I already have a couple ideas. I'm happy to throw them out at, you know, now or at that time. But, you know, I think that it's going to take, let's take a couple months, let's brainstorm, let's throw some stuff against the wall, let's see what's realistic, who can do the work, right? Maybe we need to, you know, chat with those agencies to, you know, to find them. I think one of them is like, you know, Nikki Fit, if there's a way to like, you know, get Nikki to do some stuff at health departments and like train up folks. I think that would be awesome. But who knows? So come in September with ideas of, you know, how to implement what we have done for the last 6 months. And yeah, let's figure out how to move it forward. If we can collect some data on it, that's what I love, you know, so we can evaluate it and show that it's working. But now's the fun part. Anybody have any comments, questions, suggestions, anything else we want to talk about today before we move on? Everybody's good? Okay. Well, I'm not going to take up, you know, more time than we need to, right? There's no reason to do that. So have a happy Thursday, and we'll see you in a couple months.
Thank you.
Thanks, everyone. Bye.
All right, guys. Be safe. See ya.
Thank you. Bye.
Bye-bye.